Hi, everybody. This is Stephen Aquario, the Executive Director of the New York Association of Counties, and today is March 28th, 2020. This report will cover activities at the state and federal level for March 27th and March 28th, 2020, as it pertains to COVID-19 updates and alerts for county officials. As your association at NYSAC, representing the 57 counties of New York and the City of New York, we will continue to do everything we can to support you at the local level during this time of extreme crisis. We continue to update our website at nysac.org/health. That's the site where we post the most up-to-date information that we can get from the State House, from the New York State Department of Health, from the Center for Disease Control in Washington, D.C., and from the White House. We are posting on that site with new information daily. We have added the newest executive order signed by Governor Andrew Cuomo on March 27th, 2020. We are including guidance from the State Education Department on important information for telehealth options for preschool special education services. We will also be sharing that with your preschool special education coordinators this week. And we've also included a new NYSAC report on the federal stimulus package that you've heard about, you've read about in your newspapers, on the television, and on the radio these past few days with the information coming to us from Washington, D.C. We also continue to produce a blog on that COVID-19/health website. That's where we're including county best practices, innovative ideas, where the counties, both large and small, urban and rural, we are posting innovative ideas that are really designed to bring the information from the larger counties who are really attacking this virus for the last several weeks to the smaller, more rural ones who can learn from the larger ones and the ones facing this epidemic earlier on. So we have tweets that we're putting out and podcast material that you can also find to be of value for your counties. Look, if there's something that you need an answer to, you have a concern of or for regarding the COVID-19 virus that affects your county, please send us an email at coronavirus, all one word, at nysac.org, and we'll do our best to get back to you promptly with timely and important information to answer your question, or just to send us an idea that you are doing in your county that you feel would be of benefit to another county around the state. And we post those ideas on the website. We're the only statewide association that is representing county government in the state of New York. So what you're doing will be of value to somebody else. I can guarantee you that. Yesterday, March 27th, we launched a new social contact, a connector campaign called Take 5 NY. This is a campaign designed for elected officials, legislators, supervisors, executives to call on their residents. For elected officials, a county clerk, a district attorney, a sheriff, anybody, a supervisor who's elected, who's responsible to the people, to call on the residents to just take 5 minutes to call on someone, a friend, a neighbor, an acquaintance, to say hello. There's a lot of information right now, a lot of social isolation. People are getting a lot of material thrown at them. See if they need anything, lift their spirits, and just simply tell them that they're not alone. Look, these are very difficult times for all of us in any area of the state. And if you're going through this right now, people right now need to hear from you. These are difficult times. New Yorkers are feeling more isolated, lonelier, and while we're all feeling this way, it's important to reach out, and that's what this campaign is about. If you want to adopt this locally, we'll provide you with a press release, some talking points, and some social media posts to help you get started. This is another way that county officials are out helping to reach out to their public. So it's called Take 5 NY campaign, and we'll be putting that out this week. Thank you very much for all your help in that regard. Some observations. Automobile dealerships. Very important to keep this industry open, alive, and well for those individuals that have been planning to purchase a new car. We're very pleased to report that the guidance for what private businesses are deemed essential was amended yesterday, March 27th, by the Empire State Development Corporation. This guidance is for relates to Executive Order 202.6, and an essential business list now includes automobile sales conducted remotely or electronically with an in-person vehicle return and delivery by appointment only. That's very important. This appears to mean automotive sales can be conducted online or over the telephone, and trade-ins and delivery of the car must be done by appointment. So that helps keep business going, keep customers able to purchase what they were supposed to purchase or turn in what they were supposed to turn in for their vehicle. County clerks can and are still processing automobile dealer work across the state with this change. They can do this at safe distances by mail or electronically. This dealer work produces a good deal of revenue, sales tax revenue for the state of New York and for the local governments, and it's very important. Revenue is very much scarce right now with the decline in the economy, and so if we can help customers keep what they're trying to do on track and help government collect revenue to help provide public services during this time of crisis, that's a good thing. So we wanted to update that. Upstate county clerks who do process this dealer work, they can do it from outside of their individual counties as well, because they can often get it done faster. So these county clerk's office are open for business. Construction work. We've taken a lot of calls from county legislators and supervisors about construction work. Also, the state amending the essential employee list, narrowing permissible construction work. This change effectively halts all construction statewide, except for what's deemed essential construction, like roads or work that's needed to secure a site to shut down and work by a single person as the only worker on that site is deemed essential. This single person must likely mean a handyman or a solo contractor performing renovations by themselves. They can still work as long as safe distances are practiced. That's a very important update, and we thank the state for doing that. Some frequently asked questions by the Office of the State Comptroller was posted yesterday on March 27th, and if you go online, there is a link directly to the document on the local government page of the Comptroller's website. That's at osc.ny.us/localgov/general information FAQs related to COVID-19. That will be a continually amended document for our local government officials to look and see what the Office of the State Comptroller is saying, is doing with respect to audits or other financial matters between the state and the local governments. We had a question responded to us, an answer given to us on asking, we had asked the state about civil service exams over the next 60 to 90 days. The state did answer that question by posting a list of exams that the civil service exams for March 28th and 29th, 2020 have been postponed. And if you go on the state civil service website at www.cs.ny.gov, they give you a complete list of civil service exams that are canceled. We do want to put that out to you as well. COVID-19 status update. As of the 28th of March, the state has 52,318 total positive results. That's up from 37,258 yesterday, or an increase of 16,000 positive from our last update. Of that 52,318 positive, 7,328 are hospitalized, and of that, 1,755 are in the intensive care unit. Reporting in from New York City, the metropolitan region continues to be the epicenter of the pandemic in the state of New York and in the United States. Daily intensive care admissions are slightly down from yesterday, which is a very positive sign, but we don't know if that is going to be the norm. Hospitalizations have dropped slightly. Again, we don't know if that's going to be the norm. The governor had a press conference yesterday on the 27th, and he announced that there will be a school closure for another 2 weeks. The current order expiring on April 1st has now been extended until April 15th. The state will reassess that every 2 weeks, and the governor is also extending that 180-day waiver. The United States Navy comfort ship should be arriving in New York Harbor on March 30th. Today, March 28th, the governor had a press conference. He talked about ventilators. He talked about you need to get a bag valve mask to manually operate a ventilator. He was describing what it's like to use a ventilator and needing to do it manually. He described how to do it. He talked about the state purchasing certain bag masks, and he talked about considering training National Guard to use the bag valve mask. The governor gave an update on the federal distribution of 4,000 ventilators to the state and spoke about the strategy of dealing with the overwhelmed healthcare system in the state. Talked about if a local hospital is being overwhelmed, that new patients need to be shifted to another part of the hospital or on a regional basis. The state has mandated that. The state may step in and shift patients between regions or upstate and downstate hospitals. The governor making that declaration today on March 28th. The state has asked pharmacies to do free home delivery, encouraging pharmacies to reduce the lines in a pharmacy. The state continues to monitor density and activity in New York City and downstate parks, in particular playgrounds. Similar density and activities are happening in capital region communities, and I suspect this is happening in communities all across the state. The state may close playgrounds if density compliance doesn't work on a voluntary basis. The state is administering various drugs, trial drugs controlled by the state. Talked about the temporary 1,000-bed hospital will open in New York City very soon. The president approved 4 new sites in the New York City metro region, and the governor is going to have the state go to a COVID-only hospital and isolate 600 beds, all for downstate COVID-only patients. The governor reporting the state has gained approval from the federal government to start allowing the antibody tests for those who have recovered and have tested positive and are now symptom-free, and doing some antibody testing there. New Yorkers who have recovered from COVID-19 have a high level of COVID-19 antibodies, which can now donate their plasma, which hopefully can be used to treat sick patients as we go through this trial period. The governor talked about the state received a large shipment of personal protective equipment and will be distributing it to counties across the state of New York based on need. The Office of Emergency Management is to contact your county Office for Emergency Management about these supplies. However, the State Office for Emergency Management said that not all counties have submitted a plan. So we are encouraging all counties to submit a plan to the State Office for Emergency Management for your needs for personal protective equipment supplies. Please contact your regional representative to see if they have a plan for your county so that they could receive personal protective equipment from the state stockpile. In other news from today, March 28th, the state announced that it will be deferring the April 28th presidential primary and special elections. There were certain state elections that were to take place on April 28th for members of Congress and members of the state legislature. They are now all being moved to June 23rd, 2020. And the secretary to the governor, Melissa DeRosa, said that the state will move all outstanding elections to June, including village elections. The governor also said on March 28th that the state could not draw down any of the 6.8 stimulus funds tied to Medicaid and the enhanced FMAP, or the federal matching percentage from the federal government to the state. Of course, this is very important to the counties, as the counties have over $1 billion of federal relief tied to the state's acceptance of the Medicaid program. We are hopeful that our governor can continue to work towards accepting this federal Medicaid package, and that it will work consistent with the work of his Medicaid redesign team and the needs of the state and its state budget, which is currently pending and expected to be approved over the next few days. So we remain confident that the governor, on balance, will view that the federal money is in the state's best interest to accept, and thereby allowing the counties and New York City to receive that direct federal Medicaid percentage as well. We're very concerned about that. We'll monitor that very closely and are offering our full support and participation with the state as we continue to reform the Medicaid program in the state of New York. A quick highlight of the governor's executive order yesterday, March 27th. This is 202.11. All schools again closed until April 15th. Violations against any prior order limiting operations or density of persons in a space, any violations of that requirement shall be considered a violation of the Uniform Code or local building code and enforceable by any state, county, or local police officer. The officer may remove persons from such facility and can also issue an appearance ticket. All guidance issued by the State Department of Health related to the prevention and infection control of COVID-19 supersedes any prior order of the Department of Health, local board of health, or Department of Health, or any political subdivision relating to the same subject. The March 27th executive order allows all non-public opening of bids, but the public entity shall record and live stream bid openings so the public can see, and that's done in a transparent process. The executive order waives certain portions of the mental health law and the New York Code of Rules and Regulations to allow mental health services to be provided in other than certified settings, or extend training or recertification deadlines for direct support professionals employed in mental health regulated facilities. It modifies the social services law to suspend the duration and the amount of reimbursement for domestic violence victims in shelters. There was a 90-day limit with a 45-day extension that is now waived. The executive order allows pharmacies to compound alcohol-based hand sanitizers. It allows pharmacies and pharmacy technicians to practice at alternative locations or from home. It allows registered nurses and licensed practicing nurses, graduates to practice under supervision of a registered nurse for up to 180 days following graduation. It grants defense and indemnification to physicians assisting in COVID-19 responses working in SUNY-operated or owned facilities. It suspends 30-day requirement for submission of certificates of residence to community colleges. Again, the treasurers have been talking about this across the state. This executive order suspends 30-day requirements for submitting certificates of residence to community colleges and allows those applications to be made through email or mail. It extends the license or certification renewal of a range of licensed professionals, various number of them. I won't read through them all. Extends deadlines for Adirondack Park Agency responses to variances, permit modifications, and permit requests. Extends vehicle inspection for vehicles designed to carry passengers voluntarily placed out of service due to COVID-19 for 30 days. So for cars and trucks that are placed out of service due to COVID-19, meaning you can't get to the inspection, because you're either under a quarantine or you're concerned about someone entering your vehicle. We've had a lot of requests for this. That's been extended for 30 days beyond the current expiration. Tolling current valid car inspections, we just talked about that. Allowing electronic signatures for forms or authorizing or accepting funeral services, and notary publics, again, is also able to be done online rather than in person. Quick state budget update. The state budget negotiations continue to evolve. Negotiations are quickly underway right now on March 28th as we speak, as we head towards the April 1st deadline. We have been told that certain things have been policy decisions where there's any degree of controversy that can't be resolved by way of meeting online or conversations or negotiations that could reach a conclusion are being dropped from the budget discussions. We're very optimistic that an omnibus extender will be included in the budget for all county home rule requests, sales tax extenders, hotel motel tax extenders, mortgage recording tax extenders, or other extenders which expire in June through the end of the year are also expected to be approved as part of one omnibus package without the need to do a home rule request or a home rule enabling resolutions. Not so sure on Part R, which is the Medicaid provision, which opens up the state Medicaid cap program for county governments. We're not sure if that will survive. Of course, county governments and the city of New York asking the state to either defer that decision or eliminate that proposal in its entirety, give us a chance to work back and forth with the state of New York on redesigning the Medicaid program. The president announcing yesterday he is implementing the Defense Production Act to require General Motors to produce ventilators for the federal government, and we're hopeful that he can get that production of ventilators for the state of New York to deliver what the governor has asked for, an additional 30,000 ventilators, but also ventilators for other parts of the country. Of course, the ventilators are needed for intensive care units and patients in the hospital which need intensive care, and the ventilator is typically part of that. The United States Congress, the United States Senate passing the CARES Act, which it is known by, the CARES Act, the third stimulus bill. A lot of this does put in place a lot of money for the communities, for individuals living in the state of New York, small businesses and large businesses in the state of New York. Yesterday, NYSAC released a federal stimulus package overview, and I would encourage you to review the NYSAC website to see that announcement. But look, folks, as we come into the beginning of the week here, as we approach April 1st, the state budget coming into shape, there's going to be a lot of work here together for the counties to continue this partnership with our state, with our governor, and continue to help the people of the state of New York. We'll continue to be your association, providing you this information on a daily basis. And again, if you have any questions, comments, or concerns, please send them to coronavirus@nysac.org. Coronavirus@nysac.org. That'll conclude this evening's report. Thank you very much.